Hi and welcome. My name is Katie and I'm a public health nurse with Ottawa Public Health. Childhood vaccination rates dropped significantly during and after the COVID-19 pandemic, putting children at risk for preventable diseases like measles and polio. I'm here with Dr. Trevor Arneson, Deputy Medical Officer of Health, today to talk about how you can protect your child. Hi, Dr. Trevor.
Hi, thanks for having me.
Yes, thank you for coming. So we'll just jump right in. Can you tell me why it's important for children attending school and daycare to be vaccinated against diseases like measles and polio?
Yeah, for sure. So children attending school are going to be potentially exposed to various viruses. And in school settings, with kids all playing together and in really close settings, a lot of viruses can transmit really easily. So it's really important for everyone that as many people are vaccinated as possible in those settings. And that's why we have a system in place so that parents report their vaccinations of their children, and we check it every year at Ottawa Public Health.
So basically what you're saying is the more children that are vaccinated, you're creating a sense of herd immunity or community immunity.
For some diseases, it's really important that almost everybody is vaccinated to prevent the introduction of that disease. So measles is a good example. In Canada, we've eliminated measles for many years now, and that's because so many people are vaccinated that even if a case of measles comes into our community in Ottawa, it burns out. There doesn't go anywhere because there aren't enough people susceptible, meaning able to get the disease, that it can continue in the community. So that's one of the main benefits of vaccination. But of course, vaccination also protects the individual. So by being vaccinated for most diseases, you're fully protected against that infection. And for many diseases, it can lessen the symptoms or really decrease severe disease of people who are vaccinated.
Recently, there's been some cases of whooping cough that have sort of resurfaced. I know we've had some cases locally as well as through Ontario. Can you talk to us a little bit about, what the concern is with whooping cough, and is it dangerous?
Yeah, so whooping cough is really serious for young infants, so especially those babies that are newborns or the first few months of life. We have a very successful vaccine against whooping cough or pertussis, but it does lose its protection over a number of years. So older children and adults often are not fully protected against whooping cough. But in that age group, they tend not to get severe disease, so it's not a huge worry. But this is one of the examples where we need to make sure that children are protected by vaccination, and then also others in older age groups, by keeping up to date, we can also protect those children as well from getting whooping cough. We're seeing this year a surge in whooping cough, especially in Quebec and now in Ontario, and it's impacting the Ottawa region and the Gatineau region. And we see that every few years, but this year it's particularly high in numbers in both Ontario and Quebec, and it's a really important time for people to get vaccinated. We have a new method of protecting the youngest babies, and that is to vaccinate pregnant mothers. And that's working really well to transfer the antibodies that the mother makes to the baby, and then the baby's protected until the baby is able to be vaccinated at 2 months.
If a parent thinks their child is overdue for vaccines or missing vaccines, what can they do?
I think it's important to know that's a common scenario that a lot of parents face. I'm a parent myself, and it's hard to know what the vaccines are that are required at different ages. And between 4 to 6 years, there's additional vaccine boosters that are given. So we give a whooping cough vaccine booster around 14 to 16 years of age, along with a tetanus and diphtheria booster. So it's important to check if you have a child in the sort of 7 and 17-year-old age groups. Those are really important vaccine milestones. I would recommend that people use parentinginottawa.ca/immunization. That website is really helpful, even myself as a parent, looking at that to try to figure out which vaccines I need to report to the school, and also what vaccines might be needed for school attendance. There's also an app that's been made by a local Ottawa inventor to record your vaccines. It's called Can Immunize app. And it's really helpful as well because it lists out all of the vaccinations that children should receive by the different age milestones. And it can help you keep track of what vaccinations have been done. And it can also help you to send that information to Ottawa Public Health for the school reporting. So there's a link within the app where you can directly send your child's information to Ottawa Public Health so that they can record it for school attendance.
Yes, and I mean, this information, it can be very confusing to parents, right? As people may not have the knowledge of what exactly they're looking at when it comes to the names of the vaccines and all the different antigens. But I think what you said touched on a really good point, is that if you're comparing to the schedule online, it'll show you what's missing. So some parents might still be using their yellow books, or their doctors are keeping track of the vaccines. It's always a good idea to maybe give them a call the healthcare provider, if you have access to one, see if you're missing anything. And there's lots of opportunities for kids to get up to date as well.
Yeah, that's correct. So many people do have family doctors who are ensuring they keep their patients up on all of the immunizations and keeping records at their offices. So if people have questions about vaccines, it is important. If they have a family doctor they can speak to, or a nurse practitioner, that's an important place for information, and you can get reliable information there. I also want to note that it's actually the parents' responsibility to report the children's vaccines to Ottawa Public Health or the public health unit where they live, so that the child can attend school. So that is not something that the physicians or doctors or nurse practitioners are automatically doing. And that's why the Can Immunize app, or going on our website and using some of the tools that are available to report immunizations, is really important for parents.
Now, that's really helpful. I think that a lot of people might not know that healthcare providers don't report. There might be an assumption, right? So I think it's good that parents are reminded, including myself, to report their child's vaccinations to Ottawa Public Health. A lot of families are unattached, and basically what that means is they don't have a healthcare provider. So in those circumstances, what are you telling parents? Where can they go?
Yeah, Ottawa Public Health has recognized that many people are having issues with finding a family doctor right now, or a nurse practitioner. In partnership with Kids Come First, which is an initiative of the Children's Hospital of Eastern Ontario, Ottawa Public Health is offering clinics for vaccinations in the community, and you can go on parentinginottawa.ca/immunization to get access to the booking links for those clinics. There's also something that's happening called neighborhood health and wellness hubs, which are really a great place for immunization information and also to get immunized. And these are in some high priority neighborhoods and locations across the city for parents. They can bring their children there on a drop-in basis, and they can get vaccinated, or they can check their records against what has been reported to Ottawa Public Health already for school attendance, so that they can update their vaccines.
So Ottawa Public Health does a process every year where it's called surveillance. And this year, we're going to be reviewing records of 7 and 17-year-olds. Can you talk a little bit about surveillance and what parents might need to know? So
surveillance is the process where we check vaccination records. So this year, we're focusing on the 7 and 17-year-olds because that's important age groups for vaccination. And basically, what we do is we just look to see, for all children in those age groups, do they have all the necessary vaccines reported to us for school attendance? If they don't, we send a reminder letter to parents. If we still haven't received the information, then we send a second letter, which advises that the specific vaccines that are still out of date, and it provides a notice that the child could be suspended if they don't have those vaccines within a certain amount of time. But it's not our goal or intention to get anyone to that stage. Our goal is to really ensure that people have all the opportunities they can to update the vaccines and report them to Ottawa Public Health before we issue those suspension notices.
So from what I'm understanding, it's sort of a long process. It's not just here's a letter and then you're suspended. There is a certain amount of months that happen leading up to and in between where parents will have an opportunity to get back to us.
Correct.
And like you said, a lot of the times the vaccines are given, but we just don't have the information. I think that's really important, is that not to be alarmed as a parent. If you receive the letter, read through it, follow up with us, and there's a lot of people who can help with getting their child up to date.
Yeah. The letters that we send have actually a lot of helpful information. It can be hard to navigate all of the different vaccines that children might need at different ages. And that's not the expectation of the parents. They can reach out to healthcare providers, family doctors, nurse practitioners regarding what vaccinations are recommended for their child. But additionally, parentinginottawa.ca/immunization has a lot of information, and the letters refer parents to those sites for trusted information about vaccines.
And something important to keep in mind too, and I thought this would be helpful for parents, is when you read the letter and you see a long list, we have to keep in mind that a lot of vaccines are combined. So listing all the different kind of diseases, to not be alarmed if you see, 6 or 7 things. It's usually a combination vaccine. It might be just 1 or 2 vaccines missing. That kind of leads into another question. So we talk a little bit, or we hear about the term vaccine hesitancy or uncertainty when it comes to choosing to vaccinate. What advice do you give?
So first of all, the advice I would give is to speak to a healthcare provider that you trust if you're making that decision. It's actually a big decision not to vaccinate, because vaccination is a really important part of prevention in childhood healthcare. There's a lot of infectious diseases that are really quite severe in childhood. It's important to know that the vaccines that we use in routine childhood immunization, which we're talking about today, have been around for a very long time. They're essentially the same vaccines that many parents had when they were children. And they have a very long safety record. And we have a very robust safety system in Canada for vaccination, where any adverse events are reported and monitored across the country, province by province, and they're reported up internationally. So these are vaccines that are well tested and are something that we know are safe for children and really protect against these very serious diseases. What we don't see a lot anymore is those diseases themselves, because the vaccines have been so effective. And sometimes, it's a shocking reminder when we see diseases like measles or even polio has been reported in some countries around the world that hasn't been in many decades. How severe it can be and how life-threatening it can be for some children.
So thank you very much, Dr. Trevor. I really appreciate you being here with me today.